Amazing grace, how sweet the sound that saved a wretch like me. I once was lost, but now I'm found. Was blind, but now I see.
This is the Cornea Research Foundation of America, a world-class research and educational organization dedicated to the preservation and restoration of vision. The Cornea Research Foundation of America was formed in 1988 to establish a world center for clinical research and education specializing in corneal disease, corneal transplantation, and intraocular lens surgery. Today, the Foundation's work is increasingly important as more Americans than ever before are facing the threat of blindness from age-related disease. The Foundation is a leader in conducting clinical research that is helping develop new methods, new surgeries, and new treatments to meet this challenge. And at the same time, the Foundation is providing advanced care to people who otherwise might be without hope.
I had a detached retina. That happens sometimes when you're in your 50s. And they tried to reattach it twice and it didn't work. The best I could see is like hand motion in my right eye. I wasn't able to see people's faces. I could see lights in a room and that's about it.
When I first was diagnosed with aniridia when I was a baby, when I was a child, I would go out to the well-known eye clinic out at UCLA, and they just basically told my parents that there was nothing that I would do. I mean, I recall a specific quote was that Tricia won't amount to anything, she'll have to be institutionalized.
Today, corneal transplant surgery is the most widely performed solid tissue transplant surgery. The Foundation's founder, Dr. Francis Price, is a world-renowned surgeon and has performed the largest number of small incision cornea transplants in the world.
We started out doing corneas. We also do a number of other procedures, glaucoma surgeries, cataract surgeries, LASIK. And in all those different surgeries, we've actually done studies. The first thing that we did was to start a database to track how corneal transplants did. This has become really the largest one in the Western Hemisphere, certainly all of America. We're currently doing a study of a novel glaucoma device to try to come up with a better way to treat people with that condition, so perhaps drops wouldn't be needed all the time. And we're looking at a new anti-rejection medication for corneal transplants that could revolutionize that.
The Cornea Research Foundation is dedicated to 4 primary endeavors, referred to as RISE. Research, to give people back the use of their eyes. Innovation, through the pursuit of new procedures, treatments, and discoveries. Service to humanity, through the free dispersal of our research findings. And medical education, for doctors and patients. Today, the Foundation is involved in far-ranging research efforts, including corneal transplant research, and finding better solutions for the treatment of myopia, Fuchs dystrophy, keratoconus, and other conditions.
It's hard to believe, but actually the first corneal transplant was performed in 1905. And now in the 21st century, we're seeing some major changes in corneal transplantation, and we've been privileged to really be at the forefront of those changes. We've actually helped to lead the changes. Dr. Price was one of the early adopters of a new corneal transplant technique that can just be performed through a small incision and without any sutures at all. With the new technique, the recovery is very rapid. They can get right back to work. So people now in their 40s and 50s are having this new transplant technique. Around the world, there's been a chronic tissue shortage. This technique, because we're just replacing a single cell layer, really lends itself to trying to take donor corneas and expand them in the laboratory to culture cell sheets so that we can maybe take one donor cornea and use it to help 100 transplant recipients.
If successful, these cell sheets could play a major role in helping alleviate the worldwide shortage of donor corneas. The clinical research that the Foundation conducts not only helps to find new treatments, it also restores hope to individuals and their families.
With our surgeries, we track all the results. When we analyze the data, we periodically change our technique. We find that one particular type of way of putting the tissue into the eye is not as good as another way. We find that some of the things that we do make the corneas last longer. Either it's surgery, medication dosage, whatever you're doing with patients, to try to always find a little bit better way to do it.
For instance, the work of the Foundation has contributed to safer cornea transplant procedures with quicker recovery times.
In 2003, I had surgery in June. 2 weeks later, the 4th of July, I was going to do some barbecue grilling. Later, I went out to make sure the grill was cooled off, and I thought, what is that light over there? And it was a sunset, and it was one of the most beautiful things I've ever seen. My wife, she's blind too, and she's on dialysis and is usually in a wheelchair. We go out to restaurants and go to meetings and things. I can push her, as before I couldn't because I couldn't see where I was going. So that's a big, big help.
The Foundation conducts research in many areas and has been instrumental in finding improved treatments for aniridia.
I actually was born with the lack of the iris, or the color part in the eye. And Dr. Price, I had seen an advertisement that he was doing research on artificial iris implants.
And anybody that does filming knows how important the aperture size, or the f-stop, is in your camera. These people don't have one. It's open all the way, so they have no depth of focus. These are people that, you and I go to a movie matinee and come out in the bright sunlight, we're blinded, we're incapacitated. That's the way they are all the time.
I can really relate that we take a lot for granted, but I had never really seen a star in the sky. And now, I'm able to see that and really appreciate that. Driving, was a huge issue. Being able to be so independent, I didn't know what that was like because I never had the opportunity to drive. What makes Dr. Price and the Cornea Research Foundation special is because he reaches so many people's lives, not just here in the States, but also internationally, and he really wants to make a difference. And that's what, life is all about. When I go out and I speak and I tell people about my surgery, I'm able to tell them that how much of a difference it's made in my life. To me, every day is like Christmas because this was a gift that I was given.
Altogether, there are hundreds upon hundreds of people around the country that have benefited from the work of the Cornea Research Foundation. The Cornea Research Foundation is unique. As an independent foundation, it does not rely on support from government agencies. Instead, the foundation depends solely on donations from individuals, organizations, and grants.
Well, it's always a struggle. We're in private practice. We're not a big university, so we don't have a huge, source of revenue. But there's a lot of people that we touch their lives, and a lot of people have a personal interest in what we do, either for themselves or for someone they know. And the word is getting out on that. We have basically donors from all over the country now. We identify a need, something that can really help people out. And that's where I think that we're real important, is that we fill that void that might not be done otherwise. I think we're just on the threshold of being able to make some tremendous changes, not just what we're doing here, but probably for the whole world with what we're doing. Based on these different studies and what we're learning and some of the research we're doing, just culturing tissue, I think that it's going to be truly amazing, and the foundation's going to be a big part of that.
The Cornea Research Foundation of America, developing solutions and inspiring hope.